Halo.
Habari mama?
Mzuri sana. Uko nyumbani inaweza kuja?
Niko nyumbani lakini kwa nataka kukimbia na hapa kwa shamba kupanda juu mvua imeanza kunyesha, lakini naweza kungoja tu.
Usiende juu ya mtoto. Wacha nikuje nione venye yako. Habari zenyu? Mko salama? Bibi anaendelea aje?
Nakuru is a very big county where we have a population of 2.2 million. One of our strengths in Nakuru County in terms of health is we are able to provide services up to the community level. And that's one of the program, which is community health volunteers we've put on the ground, where through the help of partners, we've been able to provide tools and equipment and training to be able to provide the essential medical services to people in the community.
In a world that is geared towards the achievement of universal health coverage, community health workers play a great role in creating the link between the community and the larger healthcare system.
Health services are reaching household levels because basically CHWs do a lot of health promotion and they do a lot of health education in the community level.
Sasa leo nimekuja juu venye tulikuwa tumeongea maneno ya usafi, kama mlichimba shimo ya takataka, ndio unajua sasa amwezi chomea takataka pahali yoyote saa hizi juu kumeanza kunyesha, mmetengeneza shamba. Tukaagana mtachimba nini? Shimo ya kuchomea takataka. Na nadhani mmefanya hivyo. Jambo zingine, saa hizi ni wakati wa mvua. Kukiwa na mvua muwe na kitchen garden. Si ndio? Mupande mboga, vitunguu, vitu chache zenye sio lazima muende mkanunue sokoni. Ndio muwe na vitu za kuongeza afya mwili, muweze kuwa na afya, muweze kuendeleza na mpate hata mapato ya kusomesha watoto wengine juu si hao wengine wako shule. Kwa hivyo ya leo tu sio mingi, ni hayo tu, lakini ningeomba nipewe kitabu ya kliniki nione wenye mtoto anaendelea, nione kilo.
My name is Mary Waweru. I coordinate community health activities in Nakuru North Sub-County. Most of the times we coordinate with the community health extension workers or CHWs who roll the activities up to the CHWs, and then the CHWs roll the activities up to the household level.
Kwa majina naitwa Esther Modhoni, CHV Game Unit, na kwa leo nilikuwa nimekuja kufuatilia client wangu ambaye anaitwa Susan na Mutua, na kwa leo nilikuwa nimekuja kujua vile mtoto anaendelea, kama anapata immunizations, chanjo zake ambazo anastahili kuwa akipata, na pia mambo ya kunyonyesha exclusively. Hiyo inamaanisha anyonyeshe mtoto bila kumpa chochote kwa miezi 6. Ndio nilikuwa nimekuja kufuatilia kwa leo.
Most of the time our patients come when it's late. Let me say especially critical ill patients, when now instead of having preventive you go curative. And that's why we ended up starting the CHV program, where we have 33,620 to mop out people from the village.
Kwa majina naitwa Maslin, mkaaji wa hapa Pondamali, na ninashukuru Mungu kwa kunijulisha na community workers, kwa maana tangu niwajue kuna vile wamenisaidia. Sana nimebenefit upande wa ujauzito, kwa maana kuna wakati nilikuwa nimegonjeka na wakakuja kanitoa kwa nyumba niende hospitali. Hiyo wakati sikuwa nimejua niko na pressure, lakini baada nishaenda hospitali nilikuja nikabainika niko na pressure na nikaanza kutibiwa. Ninamshukuru Mungu, sasa hizi niko salama.
What motivated me to become a health volunteer? My father was a diabetic and my mother was a hypertensive. So it motivated me when I was taking my father for MOPCs. I see how the queue is long, and I decided if I can have education of helping elderly, it will help me a lot, and I will help another households.
We started in 2008, one section of Nakuru West. We later realized it's an important program, and it's been rolled It started rolling to other units for quite a while, and in the end we ended up rolling up to now where we have 362 community units. So you find that these community volunteers are very important because they ensure they follow up our mothers to their household, then bring them to the health center, assess them, and they're able to determine through the training who is meant to be sent now to either a health center or a hospital based on what they find. They also they promote a lot of hygiene and sanitation in our villages. Remember, even with diseases we have, communicable diseases we get, is due to hygiene and sanitation. So teach them how to practice, be clean, have a clean environment, sanitation in the village.
Mimi napenda hii kazi. This is voluntary work. Na ninapenda sababu inafanya tunakuwa na interaction na wenye kijiji, na tunaweza kusaidia hata hii facility, kusaidia kuingia mashinani kujua what is the real cause down there.
As they move from door to door in their own catchment areas, they are able to talk to the mothers, talk to the fathers, talk to teenagers. Every individual in the community can receive a message, and that has really helped us in improving health demand creation in Nakuru County.
Niliishi nikipenda tu kuweza kuhudumia watu, kusaidia watu, na hiyo ndio ilikuwa kwa moyo wangu tangu hapo kitambo.
Sitaki kuona mtu akiteseka hapo ati ni mgonjwa. Na beba hiyo mzigo ni kama ni yangu. The county government has supported us so much, and the CHWs appreciate the support they get from the county government.
Tunapata mafunzo. Mafunzo ndiyo kwanza kitu ya muhimu sana. Hayo mafunzo ndiyo inafanya sisi nasi tunakuwa na hiyo interest, sababu huwezi fundisha kama hujafundishwa. Sasa hiyo mafunzo ndiyo inatusaidia sana, tunaweza kuingia chini na tunapenda kazi yetu, sababu kama huna elimu huwezi fundisha watu na hawezi kukuelewa.
We receive stipend a month 2,000, but you are not given in a month, you are given after 3 months. If they could do it every month, every end month, you know you will have something from the county. Every month you know you have something, and they add it at least. We will be happy and we will appreciate.
Pia tunajihusisha na projects kadhaa. Tuseme kama every month, kila mwezi tunakutana, tuna vitu tunasema table banking. When we are forwarding our reports, tunakutana, tunasema hata kama ni hivi lazima tujue tutaweza kujijenga namna gani.
Kwa majina naitwa Dorcas Kinyanjui, na mimi ni CHV hapa Mangu Unity. Kwa hapa tulikuja, huyu mama ni rafiki yangu, tunakuaga na ushirika na yeye. Na tulipojua maneno hii ya Satopan, Satoflex na Satostools, nikajua angehitaji moja, kwa sababu hapo mbeleni alikuwa ameanza kuwa na shida ya magoti.
Ninashukuru kwa vile nilijua kuhusu hiyo Satopan, kwa sababu nilikuwa na shida, na niliposikia habari ya hiyo nikaona ni vyema mimi nilipe nikuje niwekewe.
Tuna install at a fair fee. Besides that one, tuna hii shamba iko hapa. Tumejiunga sasa, tumeshirikiana, tumekuwa tukilima, na sasa tunataka kuchange the strategy kulingana na climatic change.
So inatusaidia kama CHWs, hata kwa vikundi tukifanya kujumuisha, tunapata kitu ya kwenda nayo kwa groups.
When the county realized we were giving volunteer work without any pay, we felt these are people who wake up from the houses, go to households in the community, and at that time it's raining. They need material to write on and all that. We provide the material, but now to give them, support their morale, His Excellency came with a program of giving them a stipend of 2,000 shillings a month. And it was just a gesture of saying thank you for the good work they were doing. And in this year, when the new government came in force, Her Excellency, the Governor Susan Keheka, decided that she would that was not enough based on even the circumstances of the ground and our economy, and decided we are going to pay them 5,000 shillings a month. It is not a salary, but it's an appreciation for the work they do, and it also helps them as they are teaching these people to make their small gardens. They're also able to do something for their household.
FAH supported us to develop a community health strategy, which I think is actually giving us a direction so that we will be able to probably overcome the challenges that we are undergoing through. They're also in the process of helping us develop an investment plan. And I think by doing so, we'll be able to mobilize for additional resources to support community health services.
Beyond the development of the community health strategy, we will continue working with the county to ensure its implementation, and more so to support in resource mobilization through the development of an investment case specifically for community health in the county.
We are trying to move our services closer to the people, especially for people who have diabetes, hypertension, because we had challenges of them coming all the way to the level 5 hospital. And remember, we have only one level 5 hospital, which is Nakuru Teaching and Referral Hospital. And so there's challenge of trying to take those services up to the community level.
Kuna wakati hata maybe kunanyesha, unaona? Kukiwa kunanyesha na unahitajika mahali, inakuwa ni a bit tricky kwa sababu hauna maybe zile vifaa. Kuna vifaa ambazo unaweza hitaji za kutumia. Still tena kuna vitabu zetu hizi za kuregister households, they are so big, ni kubwa.
One of the greatest challenge we are having is issues of data tool. Remember, our workforce is also quite heavy. We have 3,620 CHWs in the county, and each needs to have a data tool to report whatever activities they are doing. We have main tools like MOH 513, which we do household registrations in the areas they are covering. And we also have the MOH 514, which basically is their daily service logbook. So each CHV needs to have these two books so as to record the activities they are doing. And that is quite an expensive adventure to have all these books in place.
The main challenge is actually funding. Funding is never enough. So to enable us establish new community health units. To enable us to increase the resource base for public health and community health services, we have the Nakuru County Public Health Act of 2017, which gives a provision for us to collect and use the public health funds, which is known as a Facility Improvement Fund. But we have not been able to implement this because we are lacking the regulations. So maybe going forward, together with FAH, we need to develop the regulations so that we can increase the funding. We can mobilize for additional resources that will support public health and community health services.
Important for me also is they are able to collect for us data. For you to run any program, you must have data to support it. What are you meant to do there? So we have a lot of partners who come on board, and for them to be informed in terms of what programs they need to do, we use the CHWs to collect and they relay the data.
Within Nakuru North Sub-County, we've been having a lot of ecosystem partners who have been engaging the CHWs into several activities like trainings, sensitizations, and some of the partners, maybe I can mention, we've been having the AMREF, the World Vision, we've been having FAH, we've been having so many partners, Meditronics, who are currently at the ground. There are so many partners that we've been receiving from the county government.
Financing Alliance have managed to develop the community health strategy, which is a great document that is going to guide the implementation of community health programs in the county.
That one is quite a plus because it's going to give us a roadmap of where we are going with community health services as a county.
To our county assembly, where we want to introduce the community health services bill, which covers these CHWs. And in that, it will be able to support the program we run on the ground in terms of the services of the work of a CHW. Because once we get a support, let's say from the assembly, even if you recommend some budget for them, it's easy because it's coming, because the approval will come from them.
What I'd like to tell the community health workers that I work with, first of all, is to congratulate them so much. They are doing very good job. Mine is to urge they put more effort, then continue with the good work that they've been doing. They should not tire.
Mtu asifanye hii sana sababu ya maripo. Usiweke pesa mbele. Angalia how much are you contributing to the community.
Waendelee tu kufanya kazi na kuhudumia, na wafanye wakiwa na moyo ambao unajitolea. Juu ninajua mwishowe hata kama hakuna timshahara wanangoja, najua Mungu atatulipa.